80% of Americans may feel helpless to act during a cardiac emergency because they either do not know how to administer CPR or because their training has significantly lapsed. I have been CPR certified 2 times already. First of all, in order to evade the situation, one must know why CPR is so important and why one needs to take action. However, before one can take action, he or she needs to be CPR certified. I am going to demonstrate to you the procedure necessary to perform effective adult CPR using a mannequin and a mouth barrier. I will demonstrate the steps in performing adequate compressions and respirations crucial in the CPR procedure. So with no further ado, this is why CPR is such an important skill to learn. Cardiac arrest. CPR is needed when one goes under cardiac arrest. Cardiac arrest is different from a heart attack, however. Cardiac arrest is when electrical impulses in the heart become rapid or chaotic, which cause the heart to suddenly stop beating. No visible symptoms are shown before a cardiac arrest happens. However, a heart attack may cause a cardiac arrest. A heart attack is when the blood flow to part of the heart is blocked. One must know the difference in order to know whether to perform CPR or not. According to the American Heart Association, 4 out of 5 cardiac arrest cases happen at home, and if CPR is not given, it may lead to unnecessary deaths. Immediate help can double or triple the chance of survival of the cardiac arrest victim. According to the American Heart Association, less than 8% of the people who suffer from cardiac arrest outside of the hospital survive. Hopefully, we are lucky enough to never have to give CPR. However, 4 out of 5 is a big percentage, and it's better to be safe than sorry. Someone you love may be in need of CPR one day. It is more likely that you will need to give CPR to someone you know than a stranger because of the high percentages of cardiac arrest cases at home. In order to be CPR certified, this is what one must do. Classes and online courses are available. There are many associations who offer these classes, and the most popular are the American Red Cross Association and the American Heart Association. The courses give and show you the complete process in giving CPR step by step. In order to be CPR certified, one must pass a written exam and a skills exam. Once both sections are passed, according to the American Heart Association and American Red Cross, one is CPR certified for 2 years, and after those 2 years, it will need to be renewed. Now that everyone knows why CPR is so important and how one can get certified, here is how to perform CPR. However, note that this type of CPR is for adults only. Children and babies have different requirements. Okay, so the first step is to make sure that the scene is safe. Once you make sure the scene is safe, the one performing the CPR has to tap the victim on the shoulder and ask if he or she is okay. So you'll tap the shoulder, are you okay? Are you okay? And you have to ask them like that. If he or she does not respond, then call for help. And if someone comes, ask them to call 911 and bring an AED. An AED stands for automatic external defibrillator. After that, you have to check if the victim is breathing. So you rip open the clothes, and you put your ear to their chest, and if you don't hear any breathing, you have to start giving 30 chest compressions. It used to be 2 breaths first, but this would delay the process of blood circulating the blood, so the American Heart Association changed it to 30 compressions first. You have to lock your hands like this, and with the palm of your hand below the breastbone, you're going to have to give 30 compressions. And they have to go 2 inches deep, so the blood can start pumping up to the brain. Once you give the 30 compressions, you're going to use a head tilt, chin lift movement, like this. You're going to put the mouth barrier. You have to pinch your nose, and then you have to cover your victim's mouth completely to make sure it's airtight seal. So you're going to take a breath and give 2 1-second breaths. And you have to be looking at the chest to make sure it rises. But what happens if no one comes? If no one comes after you have called for help, then you must give 3 sets of 30 compressions and 2 breaths first. Then you will need to stop giving CPR and go call 911 yourself. However, if someone does come, then keep giving as many sets of breaths and compressions as you can until professional help arrives. Now that we have gone over the importance of CPR, it is time to summarize what we have learned. Okay, so cardiac arrest happens when the heart stops beating. One can get certified online or in a classroom, and the type of CPR I went over is only for adults. Remember, 4 out of 5 cardiac arrest cases happen at home. It can happen to someone you love, and it's better to take action and than be sorry at the end.